students, in today's video we are going to study the concept of clearance of drug. Now this video is 14th in the series of videos on pharmacokinetics. Now as we all know that after a drug is administered, it is absorbed, distributed, metabolized and finally excreted from the body. Now clearance is abbreviated as CL, capital C, capital L. Now clearance of a drug is defined as the theoretical volume of plasma from which a drug is completely removed in unit time. That is, body tries to get rid of the drug through the drug's clearance. Now unit of clearance is volume by time. It can be milliliter by minute or it can be liters per hour. Now, clearance is calculated as the rate of elimination of a drug divided by the plasma concentration of drug. Now, let's understand this with the help of an example. Let's say that the plasma concentration of a drug is 20 microgram per milliliter. That is, 20 microgram of a drug is present in each ml of plasma. Now, the rate of elimination of drug is 600 microgram per minute. That is, 600 microgram of the drug is removed in each minute from the plasma. So clearance of the drug is 600 microgram per minute divided by 20 microgram per milliliter, that is 30 milliliters per minute. Now clearance can also be defined as the rate at which a drug is removed from the plasma in milligram per minute divided by concentration of drug in the plasma in milligram per ml. So the total capacity of a body to clear a drug from the plasma is the sum total of renal clearance plus hepatic clearance plus clearance from other tissues. Now clearance determines how efficiently the drug is removed from the body. So clearance is a measure of how efficiently drug is removed from the body. Now, higher is the value of clearance, the more efficiently the drug is removed from the body. Now, let's understand the clinical significance of the knowledge of clearance. Now, knowledge of clearance is essential to determine and thus to calculate maintenance dose of a drug. Now, maintenance dose of a drug depends upon steady state plasma concentration of the drug. Now, majority of drugs are eliminated by the first order kinetics over the therapeutic range. So very important to remember that for drugs that follow first order elimination kinetics, for all these drugs the clearance remains constant. Now look at this figure. This shows time versus plasma concentration curve. Now let's say the half-life of a drug is 1 hour. And the drug is administered orally. So the drug is administered orally repeatedly after every 1 hour. Now when the drug is administered repeatedly, the concentration of drug in the plasma increases and the drug reaches a steady state plasma concentration. So the drug reaches a steady state plasma concentration within 4 to 5 half-lives. Now this concentration of drug from here to here. So this concentration of drug is termed as steady state plasma concentration. And this steady state plasma concentration, it fluctuates between these 2 points. So it is this much and this much. So this is how this steady state plasma concentration is reached. Now steady state plasma concentration is the concentration of drug that is achieved when the amount of drug absorbed in the plasma is equal to the amount of drug being cleared from the plasma. That is, amount of drug entering the plasma is equal to the amount of drug being eliminated from the plasma. So to achieve this desired target steady state plasma concentration of a drug, we should know the clearance. So as discussed, drug concentration reaches steady state plasma concentration within 4 to 5 half-lives. Now steady state plasma concentration is equal to the dose rate divided by the clearance. Now, steady state plasma concentration is equal to the rate at which dose of a drug is to be given divided by the clearance. Now, after intravenous administration, the dose rate, that is the rate at which dose of a drug is to be administered so as to achieve steady state plasma concentration, that is the maintenance dose, is equal to desired target steady state plasma concentration into the clearance. So in order to determine the maintenance dose, it's very important to know the clearance. Now here, as the drug is administered by the intravenous route, bioavailability of drug is considered to be 100%. Now similarly, after oral administration, the rate at which the dose of drug is to be administered is equal to desired target steady state plasma concentration into clearance divided by the factor F. Now factor F is the fraction of drug that reaches systemic circulation, because here after oral administration bioavailability is not considered to be 100% and only a fraction of drug reaches the systemic circulation. So this is how clearance, the knowledge of clearance is very essential in order to determine the maintenance dose of a drug. Now as we all know that majority of drugs are excreted by the renal route. That is, majority of drugs are excreted in the urine through the kidneys. So the knowledge of clearance is very essential for the adjustment of dose in renal insufficiency. And apart from this, as liver is the main organ of metabolism and liver transports the drugs to bile, and bile carries the drugs to the gut, and from there the drugs are excreted in the feces. So adjustment of dose is also required in the case of liver insufficiency, and again knowledge of clearance is very essential for the adjustment of dose. So this is in brief on the concept of clearance and its significance. Now please note that the information provided in this video is meant exclusively for students from their examination point of view. Please do not use this information for the clinical purpose. If you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.